Hi, I'm Julie. On this occasion I will talk about the causes of vitamin B12 deficiency. Hope you enjoy it. Vitamin B12 or folate deficiency anemia occurs when a lack of either of these vitamins affects the body's ability to produce fully functioning red blood cells. Red blood cells carry oxygen around the body. Most people with vitamin B12 or folate deficiency anemia have underdeveloped red blood cells that are larger than normal. The medical term for this is megaloblastic anemia. A vitamin B12 or folate deficiency can be the result of a variety of problems, some of which are described below. Here are 6 causes of vitamin B12 deficiency. 1. Pernicious anemia. Pernicious anemia is the most common cause of vitamin B12 deficiency in the UK. Pernicious anemia is an autoimmune condition that affects your stomach. An autoimmune condition means your immune system, the body's natural defense system that protects against illness and infection, attacks your body's healthy cells. In your stomach, vitamin B12 is combined with a protein called intrinsic factor. This mix of vitamin B12 and intrinsic factor is then absorbed into the body in part of the gut called the distal ileum. Pernicious anemia causes your immune system to attack the cells in your stomach that produce the intrinsic factor, which means your body is unable to absorb vitamin B12. The exact cause of pernicious anemia is unknown, but the condition is more common in women around 60 years of age, people with a family history of the condition, and those with another autoimmune condition, such as Addison's disease or vitiligo. 2. Diet. Some people can develop a vitamin B12 deficiency as a result of not getting enough vitamin B12 from their diet. A diet that includes meat, fish and dairy products usually provides enough vitamin B12, but people who don't regularly eat these foods, such as those following a vegan diet or who have a generally very poor diet, can become deficient. Stores of vitamin B12 in the body can last around 2 to 4 years without being replenished, so it can take a long time for any problems to develop after a dietary change. 3. Conditions affecting the stomach. Some stomach conditions or stomach operations can prevent the absorption of enough vitamin B12. For example, a gastrectomy, a surgical procedure where part of your stomach is removed, increases your risk of developing a vitamin B12 deficiency. 4. Conditions affecting the intestines. Some conditions that affect your intestines can also stop you from absorbing the necessary amount of vitamin B12. For example, Crohn's disease, a long-term condition that causes inflammation of the lining of the digestive system, can sometimes mean your body doesn't get enough vitamin B12. 5. Medication. Some types of medicine can lead to a reduction in the amount of vitamin B12 in your body. For example, proton pump inhibitors, PPIs, a medication sometimes used to treat indigestion, can make a vitamin B12 deficiency worse. PPIs inhibit the production of stomach acid, which is needed to release vitamin B12 from the food you eat. Your GP will be aware of medicines that can affect your vitamin B12 levels and will monitor you if necessary.